Morning, ladies and gentlemen. Diabetes. You go anywhere in the world, one word that keeps reverberating, irrespective of age, irrespective of religion, irrespective of caste, creed, and sex. One disease that can affect anyone is diabetes. So, what is diabetes? Why are we so worried about it? Diabetes is nothing but a condition wherein the blood glucose levels are more than what they ought to be. i.e., in simple words, the blood sugar levels in the body have been elevated due to some problem or defect in the body. Let it be a problem with insulin release from the pancreas, or the body being unable to utilize the insulin that has been released from the pancreas, or a variety of other reasons. Because we were mentioning that diabetes could affect any age groups, let's try to speak about that to begin with. There are mainly two types of diabetes, although there are other varieties as well. We are mainly interested about the two varieties, namely type 1 and type 2 diabetes. Type 1 diabetes mainly affects younger age groups, i.e., newborn kids to teenagers to people in 20s. Although having said that, it can also affect adults, but it is rather rare. Type 1 diabetes is due to the pancreas being affected by various processes and being unable to produce insulin. In simple words, there is hardly any insulin in the bodies of people who do have type 1 diabetes, and hence the reason why their blood sugar levels are elevated. If this is not recognized on time and not treated appropriately with insulin, that can lead to a dangerous condition called diabetic ketoacidosis, which can sometimes lead to death. So in order to avoid this, it is very important to ensure that type 1 diabetes is picked up on time, not mistaken for type 2 diabetes, and appropriate treatment instituted in the form of insulin injections immediately without undue delay. This is about type 1 diabetes. Then, what is type 2 diabetes? Type 2 diabetes is another form of diabetes which usually is seen in adults. But having said that, it can also occur in teenage people and even children. That's because of the fact that obesity is being increasingly seen even in teenagers and kids these days. But usually it is a disease of adults and it is due to obesity. Having said that, type 2 diabetes can also affect people who don't appear to be obese, especially in the Indian context, because we Indians are at higher risk of developing diabetes despite not being obese because of the bad genes that we carry. i.e., Southeast Asians, specifically Indians, are at higher risk of developing type 2 diabetes because of our genetic predisposition. Is it the only reason as to why Indians are at higher risk of developing type 2 diabetes? The answer is no. There is more to it. For instance, if we take the environmental factors such as the food that we eat, the exercise that we don't do, etc., etc., I think that's one of the main reasons as to why the prevalence of type 2 diabetes has been increasing significantly in the Indian population. In the good olden days, people used to go to work by walk or by cycling or by taking a bus. For good, things have changed. People have been using vehicles, let it be motorcycles, let it be public transport, or cars. So what is happening in this process? There is hardly any physical activity. And even at work, what is happening? People have been eating burgers, processed foods in canteens, and they are restricted to sedentary lifestyle, i.e., they are mainly restricted to their desktops, which results in nothing but obesity. You might wonder why it happens. You keep accumulating 10 calories a day, that in itself over a span of time can translate into extra amount of weight in the form of a couple of kilos every few months, and in turn that can lead to obesity. So how does obesity contribute to type 2 diabetes? It contributes to type 2 diabetes because the insulin that is released from pancreas is unable to be used properly by the bodily tissues. If and when the body is unable to utilize the insulin that has been secreted from the pancreas properly, what happens is blood glucose levels go up. This process is called insulin resistance, i.e. the bodily tissues get resistant to the insulin that has been secreted from the pancreas, leading to type 2 diabetes. So lifestyle changes in addition to genetic predisposition is the main reason for the increasing prevalence of type 2 diabetes, especially in the Indian context. Add to this other factors such as the consumption of rice. In the good olden days, people used to consume a variety of foods such as millets, such as brown rice, and the white rice that we consume now as well. But now, over the last few decades, millets have given place to pure white rice consumption only, which means the food that we eat is easily broken down and quickly transformed into simple substances called simple sugars. These simple sugars in turn, because of lack of adequate amount of insulin in the body to combat the decrement or the rise of the blood glucose levels, leads to type 2 diabetes. So in simple words, any type of food that is easily broken down, that causes a splash or surge in your blood glucose levels, can in turn lead to diabetes in the long run, especially if it is going to cause weight gain in the long run. So ladies and gentlemen, it is time to revisit our dietary habits. I'm not saying that we ought to be consuming millets all the time. I'm not saying that we ought to be consuming brown rice all the time. What I'm trying to say is that we need to think about what we are eating, what we should be eating, and what we could be eating. So this amount of introspection might really help in preventing type 2 diabetes in the Indian context.